One part of thriving with CLL is managing the symptoms of the disease. What are the common symptoms of CLL?
So one thing that I see with nearly all of my CLL patients, regardless of where they are in their CLL journey, and regardless of whether they need active medications to manage their CLL, is some degree of fatigue. And this can range from just mild fatigue that patients notice that they need a little bit of a breather in the middle of the day, to needing more sleep at night, to not being able to exercise as much as they're used to. And that is by far one of the most common symptoms we see, again, whether or not their disease needs medication to manage it. The classic symptoms of CLL that often let us know that it's time to start medical management are not just this fatigue, but the classic symptoms are B symptoms. And we describe those as fevers, night sweats, and unintentional weight loss. Those are very common. And then some patients with CLL will also have what we call palpable lymphadenopathy, which is our term for lymph nodes that are enlarged that you can feel. And the most common places to feel these in the body are along the neck, under the arms, and in the groin.
Right. Okay. How are symptoms treated?
So if your symptoms progress to the point that your doctor thinks you need medication, they're becoming disruptive to your life, or they are getting worse and worse over time, then there are a variety of medications that we can use in CLL. And this is actually a very exciting field. Right now, the state of the field is that most patients who are starting on their first treatment for CLL will use some sort of oral medication, and that may be accompanied by an IV, what we call monoclonal antibody, or it may not. But one thing that has really changed, even since I very first started practicing, is that we no longer commonly use what I would call conventional chemotherapy to treat CLL, even though this was the standard of care just a few years ago.
Wow. So a lot has changed.
Yes, definitely.
Yeah. Why is it so important for patients with CLL to speak up and communicate with their healthcare team about some of their symptoms?
Well, for starters, we want you to feel better. That's our number one job as physicians, is we want to get you feeling to where you are feeling like your best self, CLL or not. So we want to make you feel better. But in CLL, your symptoms are actually one of the criteria that we consider when we're thinking about whether or not we need to start a new therapy, or if you're somebody who's already on therapy, whether we need to change your therapy. So it's actually very important, and your CLL doctor should be checking in with you regularly to see if you have new or worsening symptoms that might be due to your CLL.
Mm-hmm.